Hello, and a very warm welcome from us here at COVID-19 Updates from Singapore. My name is Claire Cheong, and I am a third-year medical student at the NUS School of Medicine. This is the 10th in a series of webinars brought to you by the NUS School of Medicine, the National University Health System, and the Global Outbreak Alert and Response Network. In this COVID-19 Updates from Singapore weekly webinar series, we will be sharing viewpoints and insights from leading experts in infectious diseases and related specialties and disciplines. To introduce our panel of experts for tonight, it is my pleasure to invite our program director, who is also moderator for tonight's update. Recruited to establish an infectious disease training program here in Singapore, he became the first infectious disease head of department at the Communicable Disease Center in 1992. He's also a visiting senior fellow of the Courage Fund at the university. Ladies and gentlemen, Dr. David Allen.
Thank you, Claire. Good evening and welcome to the 10th installment of our webinar series, COVID-19 Updates from Singapore. We hope our broadcast finds you and your loved ones happy and safe. More than 5,000 participants have registered for tonight's webinar. We take the opportunity to acknowledge their encouragement and support from the following medical association institutions in the region: Great Learning, Pulse All India Institute of Medical Sciences, Singapore Dental Association, and Indonesia One Health University Network. We thank you for your encouragement. Tonight, our format will be review of regional and international epidemiology by Dale Fisher, an in-depth talk by our visiting guest expert, Dean Andy Rose, followed by questions for Dean Rose, an update of current events by Dale, and then a preview of next week's guest expert and reveal of the mystery pandemic song of the week. Please do send your questions, and we welcome your comments of how we can better serve you. Without further ado, allow me to introduce Dale Fisher, Professor of Medicine, NUS Lin School of Medicine, Senior Consultant, Division of Infectious Diseases at NUH, and Chair of the Global Outbreak Alert and Response Network, hosted by World Health Organization. Dale, over to you.
Thanks, David. Just sharing my screen. So we're not breaking with any traditions today, David. We've got just go through the global epi. There has been a bit of a change. You might remember that we normally talk about 600,000 cases increase every week. So you can see we've gone down the bottom here from the 4th of June to the 11th of June this afternoon. And it's actually up about 850,000. So So that's more than usual, although the death rate over this side, it's gone up about 30,000 in the last week. Countries, US has passed 2 million now, up 150,000 in the last week, and with 112,000 deaths. Brazil, Russia, United Kingdom, the other hotspots, if there is any cold spots indeed. So here's how that is expressed on the global epi curve. You can see that the number of cases is actually increasing over the last few weeks, while the deaths have probably been coming down a little bit. And I think this probably suggests that we're just getting a little bit better at it. There is some talk from for instance, Russia. Maybe it wasn't. Maybe the deaths seem a little bit underdone, but nonetheless, perhaps we're better at finding cases, and perhaps we're better at looking after them and not being so overwhelmed. But of course, this is different in every region, and if we go through the WHO regions, you can see the African region is on that incline still. Eastern Mediterranean likewise. Pan American Health Organization also. The Southeast Asian region. We're here in Wipro, where it's fairly flat with fairly contained numbers and consistent numbers. So every region has got a slightly different epi curve, and indeed every country obviously has its own epi curve. China stays the same. Singapore clawing its way down from those peaks of 2 months ago or 6 weeks ago. Philippines likewise having a bit of a spike at the moment. Japan, South Korea with a few little clusters over recent times, causing them to, as I mentioned last week, to reverse some of their social restrictions, and Malaysia like that. Australia and New Zealand are now coming out of their lockdowns, so that's obviously extremely appropriate. They've had low numbers for some weeks now. I'm a bit nervous about how fast they're coming out of the lockdowns, but nonetheless, if it's containable, then coming out of lockdowns is obviously a good thing. India, with still 1,000 cases a day, 10,000 cases a day and 1,000 deaths a day is a problem. Likewise, Bangladesh. Indonesia is quite interesting. They clearly are. They clearly are having some problems. There's reports of healthcare worker infections, hospitals getting overwhelmed. There are testing problems, especially getting out into every island of Indonesia, and a shortage of lab personnel. The testing positive rate is between 6 and 30%. So 30% clearly tells you you're underdoing the testing, and you sort of need to build that capacity a bit more. So as everyone I'm sure feels confident with, Indonesia is probably underscoring the cases and probably the deaths even. So moving on to some other areas. Iran's got this classic second wave, if you like, when they came out of lockdown. So that's there. Pakistan, Saudi Arabia, very high numbers. So similar to Pakistan, but they're having 3,000 cases a day, 300 deaths a day. They've had about 100,000 cases altogether now. One of their major cities, Jeddah, on the ports, is under lockdown because of a spike they had there. There's curfews in place, but they're not being adhered to very well. And I know Umrah's cancelled, but Hajj is still being discussed. Hajj is much bigger and has 2.5 million people, so that's a bigger deal and is still being looked at. Rest of Eastern Mediterranean, again, fairly low mortalities, and as I mentioned, that probably reflects that it's a young population and often the foreign workers. Moving to Europe, again, big numbers in Russia, about pushing 1,000 deaths a day, 10,000 cases. UK coming down. This has got this very nice little up and down chart, which probably tells us that a lot of places aren't reporting their deaths on weekends. That looks a lot like the mobility data graphs. Spain and Italy, you can see where the black line has actually gone above the blue line. So this is sort of a good marker for the fact that they were overwhelmed with large numbers of deaths and underrating your cases. There's similar stories in France, Belgium, Holland. Sweden's up to about 4,700 deaths now with its herd immunity policy. What else? Switzerland has come down nicely. Poland's quite interesting. That's about 10% of its cases are coming from 2 coal mines. That's about 2,800. So another place, I guess, where people can't distance. So it's really spread through the population of coal miners there. Israel, this is kind of the graph that you don't want. So you've done the hard yards, you've come out of lockdown, you've been good for a month, and then you start seeing more outbreaks. And these are schools. There's about 420 staff and students in schools. There's about 20,000 people in quarantine, so they have actually shut their schools. They're desperate to not go back into lockdown. So, best of luck. They're really ramping up their testing. They want to be able to do about 30,000 tests a day. Moving over to Africa, again, I'll just let you have a look through there. South Africa, the biggest contributor with over 2,000 cases a day. And over 200 deaths a day. Uganda, they've really struggled with testing, so their numbers are obviously going to be higher. But they recently, last month, they had some big floods not far from the capital, so that really stopped all COVID work, if you like. And DRC, of course, as I mentioned last week, has got a brand new Ebola outbreak. We thought epidemiologically it was brand new, but now it's been genetically tested, and it's quite different to the one 1,200 kilometres away in North Kivu. So this is Equateur, which had an outbreak in 2018, and there's a lot of concern how to do an Ebola outbreak in a COVID world where you're actually not supposed to be going out and mixing with a lot of people, but you still need to do contact tracing and things like that. So here's United States trending down. We'll see what happens there over the next few weeks. I mentioned before, so Brazil, again, we've got this staggering 30,000 cases a day, 3,000 deaths a day. I spoke to you a few weeks ago about the indigenous people in the Amazon basin, and that has continued to worsen. There's about 2.5 million inhabitants there, 20,000 positive cases, 1,500 deaths. It affects about 7 countries, and there's been some attempts at some sort of human rights interventions because these people really are remote, no access to hospitals, and somehow the virus got in there. Closer to home, imported cases, again, like that. Community cases have come down constantly, pretty much single-figure numbers at this stage. The dorm residence continues to rumble on. If you can just indulge me for another minute, David, there's been a lot of questions to me and to this group about why is the dorm outbreak still going? So I thought I'd try and address that in a couple of minutes. Firstly, it is complicated. If you've got an outbreak with a case, then the normal thing to do is contact trace, and contact tracing, after that, you can then quarantine those. You find out who the contacts are and you quarantine them. And if you've got all the contacts and they're all quarantined, then that transmission stops, okay? So that's how you stop a transmission chain. In the dorms, it's obviously impossible to take hundreds of thousands of men and put them all in isolation rooms or single rooms that aren't being occupied. So this is why it is prolonged. It's difficult to stop. And I think I said many weeks ago that this was not going to end quickly, because we haven't been able to do that isolation or quarantine that we've wanted to do. So the strategy has been different. It's been one of pulling out all the 45-year-olds and above, so that's the older population, and at least if they don't get it, then the health impact is going to be less severe. So that was one of the very early strategies. The next strategies were really about engaging with the populations, helping them try and distance, even though it's overpopulated, giving them masks, soap, telling them not to mingle with other rooms so that they could, they're exposed to the people in their own room, but at least if they're not exposed to others, then that's helpful. We've been doing epidemiology to look for the hotspots and the sort of safer spots, and now there's a strategy of some swabbing and some serology to try and sort of get the dorms safe so that people can resume their normal lives and go back to work. There's been a lot of logistics. The food, for instance, every man had to be given food rather than cooking it in a common kitchen. And when the food was poor, we had to adjust it because the feedback from the men was important to keep them sort of comfortable in the room. So it is complex, and there are reasons why it's taken longer, and I hope that satisfies some of the questions. I'll just flick past that. I'll go to the current state. Staggeringly, in the country at the moment, there's only 3 people in ICU with COVID, 220 in general wards. In isolation facilities with mild disease, there's 12,000. So altogether, there's been 38,000. So that's why we've got high numbers, but low mortality. Over to you, David.
Thanks, Dale. Appreciate the insight. Very helpful to understand what's going on at the dorms. I want to remind our viewers to remember to send your questions via the Q&A tool at the bottom of your Zoom screen. Now it is my honor to introduce Andy Rose, our guest expert tonight. He's Distinguished Professor and Dean of the National University of Singapore Business School. He's an expert in international trade, finance, and macroeconomics. The title of his talk tonight is The Economy After COVID-19. Dean Rose, over to you.
Thank you. Ordinarily, I would say it's a pleasure to be here, but I can't exactly say that it's a pleasure to be in my apartment since I've been nowhere else for the last few months. So anyway, the economy after COVID-19. So I'm only going to have time to make a few points, and so let me try and make them large. Here's the first one. The level of uncertainty in the economy is extremely high. Now, let me run through some ways that it's high. So first and foremost, of course, we don't know when a vaccine will be developed, and even after it's developed, we don't know when it's going to be widely accessible and used. We also don't know, and perhaps from an economic point of view, it's more important, we don't know when reliable, cheap, fast testing for either COVID or the antibodies will be available, and those are very important things for economic activity. We don't know if there are going to be mutations and whether there might be second or third or subsequent waves. Singapore is an admirably transparent society, but we don't really have a very good sense for precisely how the circuit breaker is even going to be phased out and when. Now, in most societies outside Singapore, there are severe limits to the length of social distancing that any society can handle. And if you have any doubt about that, think about the places with massive informal labor markets like Brazil or India, or places where societies simply distrust authority. Again, like Brazil, and I'm sort of ashamed to say it, the United States under Trump, where the president undermines his own authority. Okay, so The duration and intensity of uncertainty is going to be really high for a long period of time. Now, we measure uncertainty in economics, and we measure it in a number of different ways. Let me mention two that are extremely important. They're measures of financial uncertainty. So there's this measure, it's actually a security that's traded on the Chicago Mercantile Exchange called the VIX, sometimes called the Fear Index. And that's a measure of how much uncertainty the largest part of the American stock market, called the S&P 500, how much volatility there's going to be in that over the next few months. And the level of uncertainty that you see in the VIX and other comparable measures is just extremely high. It peaked at well over 50. It's currently at 28, which is twice the statistical norm. So that's a big thing. But the bad news is the financial markets are actually relatively well-performing. Here's a different measure of uncertainty. There are bibliometric measures, many of them. The most standard one that's widely used is called the Global Economic Policy Uncertainty Index. Okay. Now, this is sort of measure akin to IQ, so that the norm is defined to be 100. It is currently at its all-time high, which is over 400, 433. There's all sorts of bad news from standard economic indicators, and I'll be talking about some of that. But before I talk about that, I do want to emphasize the measurement systems that we use to measure GDP or unemployment or inflation or anything like that. They were not designed to be used in pandemics. And there's a lot of uncertainty about how much we can trust them. So the first, and in some sense, the most important thing that I want you to take away if you're listening is don't trust anyone who says anything with great precision about the economy. It's just unwarranted. We're in terra incognita. There's just a lot of uncertainty. Anyone who gives you a precise estimate is not being truthful with you. Okay, so that's the first point. Uncertainty is high, and you should never forget that. What do we know? Well, everyone agrees that the economic impact has simply been enormous, unprecedented. It's unprecedented in a number of different ways. Here's the first one. It was simultaneous across a large number of countries. That's essentially unprecedented. But it has happened occasionally before, for instance, in the global financial crisis, 2007 through 2009. But this crisis, this economic crisis has been universal. Every single country in the world has been hit. And that wasn't true in 2007, 2009. So it's simultaneous, it's universal. And the other thing that we know about it is it's been really deep. It's been a disaster. Rich countries measure their economies much better than poor countries, and it's been a disaster for rich countries. I'll talk about some of the statistics later on. But even though it's been a disaster for rich countries, it's likely to be much worse for developing countries. And the two areas that are probably going to do the worst are the Americas, both Central America and South America, and South Asia. I also want to say that because this is essentially unprecedented, we really can't say much about what's going to happen going forward from the past, because past historical data is, to a first approximation, irrelevant. But a few nuggets of data just to make sure that I've given you something. The recent World Bank forecast came out just last week, and they have global GDP shrinking, essentially for the first time in modern history, and shrinking by 5.2% is their estimate in 2020. That's the biggest collapse since at least 1870. So in at least 5 generations, this is going to be the worst economic outlook that the world has ever seen. Just yesterday, the Federal Reserve, the Central Bank of the United States, came out with its policy forecast. And if you read between the lines, they say, we simply don't know, but we know it's going to be terrible. They are predicting that interest rates will not be raised in the United States, and therefore in much of the dollar bloc, for at least 2.5 more years. So that zero interest rates will be there through at least 2022. Okay, so the economic impact, enormous, simultaneous, universal. Okay, how do you understand this from an economic point of view? Well, the first thing that happened, and the most dramatic, was this was a big negative supply shock, that the supply of labor just evaporated as countries went into lockdown or circuit breaker in Singapore. As labor isolated itself, production essentially halted. This was the largest supply shock humanity has ever experienced. Previous supply shocks, when we talk about previous supply shocks, we usually talk about the price of oil rising, which makes it more difficult and more expensive to use labor and capital, and so the supply of goods and services falls. But oil price shocks are very different from what we've experienced under the pandemic. That affects one sector of the economy, not all of labor. And some countries export oil, and so they benefit. Just a small tangential note, the oil market is still in terrible shape, that the price of oil is down to around $40, which is good if you're a consumer, but it also raises massive uncertainty. Okay, so we have this big negative supply shock because labor is withdrawn from the production of goods and services, and labor is by far the most important input. But simultaneously, we have to deal with the fact that the duration of the supply shock is unknown because we simply don't know about a potential second wave of infections, which could lead to further withdrawals of labor. We don't know. I want to keep on emphasizing the uncertainty. Coincident with this big negative supply shock is a big negative demand shock. So people don't want to buy goods and services. Why? Well, first of all, they have lower income because many people have lost their jobs or can't count on bonuses that they were getting. Uncertainty makes them more reluctant to spend and happier to save. And another very important thing, which you may have noticed in Singapore, if you've been here, is you simply can't purchase many things that you might want to. Anything in the hospitality service you can't purchase. So going out for restaurant meals, taking a trip to some fun place for a weekend, you can't do that. The fear of contact, the fear that the pandemic has engendered, has lowered the demand for goods and services. So big negative supply shock and a big negative demand shock. Now, policies have responded. Governments all around the world, especially in rich countries, most rich countries, have been very aggressive in supporting aggregate demand. They've been locking down supply, but they have boosted demand. Now, some of these support programs have been very expensive. So they've been financed not by raising taxes, of course, but by issuing more government debt. So you should expect essentially everywhere in rich countries, government debt levels to rise a lot. Now, that's an important thing to understand, at least briefly. Okay, because many people are starting to worry that there's going to be a big burst of inflation because governments have issued lots of treasury bills, notes, and bonds. In the past, when lots of debt has been accumulated by governments, that has led to inflation. In the past, debts have been accumulated in large amounts, typically following a war. And so large inflations have tended to follow wars. Okay. I don't think that that's going to be a major issue now, and I don't see any reason, and there's certainly no reason to fear from the financial markets of any serious inflation. The problem that most countries all over the rich worlds, the United States and Canada, Germany, Italy, France, but especially Japan, so it's really a universal thing, is our problem before the pandemic was excessively low inflation. So a little burst of inflation, if it ever appears, is probably not a bad thing. One other thing to take away from Japan, Japan has been deflating. Prices have actually been falling for 20 years at this point, on and off. And yet Japan has found it very easy to issue large amounts of debt, just massive amounts of debt. So one of the big lessons from Japan is that rich countries can support a lot of government debt with low inflation and very low interest rates. In Singapore, none of this is an issue. The government had a very strong balance sheet, unlike most other countries going into the pandemic. They'd spent a lot of it, so this is not going to be an issue. In other countries, however, the fact is it may be, because other countries are going to be worried about a lot of government debt. And despite the Japanese example, if there's any sign of a quick bounce back in economic activity, that could lead to a premature tightening of fiscal policy. So you see that most particularly in the United States, where there's lots of indication that there will not be further support given to firms or to workers or an extension of unemployment insurance. And the premature withdrawal of government fiscal support could be a big issue in the going forward. They did exactly the same thing in the United States, but most especially in Europe after the global financial crisis. And that was one of the reasons why the recovery from the global financial crisis was so slow in the United States, and why there was a European crisis, a euro crisis, starting in 2010. Okay, so government fiscal policy is something to watch, especially premature withdrawal of government support. Okay, let me talk about a few more things, at least briefly, and then we'll open it up to Q&A. Monetary issues. Again, I want to emphasize inflation right now is very low. The financial markets do not indicate that there's any fear of expected or fear of inflation. We also have institutions in the form of independent central banks in most countries around the world, not just rich countries, but lots of poor countries too. And those central banks target inflation. So inflation is one thing simply not to worry about. Another thing that you probably don't want to worry about immediately are asset markets. One of the big lessons that was taken away from the global financial crisis of 2007, 2009 was that asset markets had to function well if the economy was going to function well. And right now, asset markets all around the world are actually functioning extremely well, to the point where many people fear that there might be a bubble in the stock markets. One of the things that you do see all around the world is this big divergence between financial markets that seem to be absolutely cool as a cucumber, very relaxed about the pandemic, and the real economy in both labor markets and goods and services markets, which just look terrible. So let's talk about labor markets for a little bit. In Europe, there have been many government supports for labor markets. So in France and the UK and many other countries, the government is simply paying firms directly to employ labor. Now, that can't go on forever, and it will be withdrawn at that point, unless there's some miracle, there will be a big spike up in unemployment. In America, there's already been a big spike up in unemployment. Unemployment is sky high. I realize that due to some measurement error, it seemed like it fell a little bit last week, but unemployment is conservatively estimated at 4 times its level before the pandemic, and the highest level since the Second World War. With reasonable probability, it will approach the levels of the Great Depression. And in America, of course, there's very little in the way of a social safety net, especially since healthcare is often associated with employment in the United States. So labor markets look terrible in the United States. They're going to look terrible in Europe. That's less of an issue in East Asia because labor markets are traditionally much more flexible, but it may come to be an issue. Okay. We're going to see some big changes in a number of different facets of the economy. There's going to be much more production at home, as there has been. This has been, the pandemic has been terrible for primary sector, which are things like mining and farming. It's been terrible for secondary sectors, things like manufacturing. But most economies that are modern, such as Singapore's, but also the United States or Japan or Canada or whatever, most people are employed in services and requires face-to-face contact. And services are just being crushed. And so long as there's serious social distancing, that's going to continue for quite a while. Because of that, because of the effects on employment face-to-face, there's going to be a rise in inequality. Low-skilled workers and women tend to work disproportionately in the sectors most affected. So inequality is likely to rise. Governments all around the world are going to try and improve their resilience to shocks just like this. Okay, so for instance, Singapore is going to try to raise more of its own food. That's very costly. To reduce the dependence on foreign supply chains is very costly. Also, messing with supply chains takes a long period of time. General purchasing power is going to fall. And that's all going to be exacerbated by the fact that small firms everywhere in the world are those that are most affected. The large giants can sit out a pandemic and a serious recession, or they can also lobby more effectively for protection from the government. Small firms are going to be the ones that are likely to fail. That leads to a diminution of competition. As competition fails, that also is going to hurt our purchasing power. So that production is going to change in a number of different ways. International trade is going to change. As we all know, the pandemic has been terrible for personal travel. Right? Many of us spend lots of time on Zoom, unfortunately. Sea travel hasn't been much affected, but sea travel, as important as it is for bulky goods, doesn't take a lot of the really valuable stuff. A lot of the valuable stuff that's transported internationally is transported in the bellies of commercial airliners. As international travel has fallen, the valuable part of international trade has also fallen, and that, again, disrupts international supply chains, and that leads us all to be poor. Okay. Let me pause at that point. I've taken 20 minutes. We're going to slowly run out of time, and I'll be happy to field some questions. If there's time later on, I do want to come back to cost-benefit analysis and the aggregate costs of this. Thanks.
Thank you, Dean Andy, for your thoughtful discussion. It's generated a ton of questions, and so we're going to move to that phase now. Clara, could you present the first question?
Yes, Dr. Allen. So, Dean Andy, we've got a lot of good questions from the audience. The first one is, it's been reported that the personal savings rate in many countries has gone up, with consumers with capital are not spending but hoarding cash, as you also mentioned. So what mechanisms can governments invoke to encourage spending from those who do have the capital?
Okay, well, the basic answer is you don't want to encourage individual consumers to spend more and save less unless you're very authoritarian, which is not in their interest. What governments do is, given that the private sector is saving a lot, the public sector should save less. And that's what we're seeing. We're seeing governments providing lots of direct purchases directly themselves. They're expanding, for instance, in healthcare very dramatically. So the public sector is tending to dissave because they can't force the private sector to save less themselves.
Next one would be, what monetary policies are left for governments to deploy? Negative interest rates? Injecting further capital?
We've seen negative interest rates. Interest rates have been negative in Japan for a number of years and in Europe for longer. Interest rates can't go very far negative. And nobody has really experienced interest rates that are negative of more than 75 basis points, less than 1%, 0.75%. And the reason is we're in this very weird situation that we issue paper cash, or if you're in Australia, polymer cash. And rather than pay a negative interest rate to store store your deposits in the bank, people can always take their cash and stick it under their mattress, at least if they're not worried about safety. So interest rates can't go very far negative. They haven't gone very far negative. Interest rates that are like minus 50 basis points are not very different from those that are zero. So we don't expect interest rates to go very far negative. What do we expect central banks to do? Central banks are almost out of ammunition. They're going to be engaging in what's called QE, quantitative easing, which is where the central bank buys up government debt to force down long-term interest rates. Short-term interest rates are where they usually operate, but if they buy long-term government debt, they force down long-term interest rates to encourage people to buy mortgages and second homes and cars and very expensive things. But long-term interest rates are basically as low as they can, so central banks can't do a whole lot more. What we have to see is action on the part of governments, elected governments, not central banks.
Thank you, Dean Andy. While we have you on the record, there's a question that requires you to look into your crystal ball, and it's, what is your best estimate of when the Singapore economy will recover?
Okay, so my best estimate, I would say in terms of GDP, when it will recover to its pre-estimate level of output, I would say probably by the end of 2021. Okay, but anyone who's listening, think about how much I'm charging you for that prediction, and that's how much it's worth. Nothing.
Okay, to add on to that question, there's a follow-up. How will we know it has recovered?
Well, the statistical agencies have a pretty good idea of how to estimate GDP under periods of tranquility. While the measurement system during the pandemic was relatively poor, within a few months, certainly in less than a year, the measurement systems will be back up to snuff, and we'll be able to compare 2019 and early 2020 with 2021.
Okay, understand. Someone called Jyoti Samani from Singapore has fielded a question, which is, given the high uncertainty that you mentioned, why has the US stock market gone up? Is it just the optimism that things are opening up in the US?
Well, there's a long way to answer that question, and there's a short way. And let me give you both. Okay, so the long form answer, if you ask people who are participating in the stock market, is they're very happy that the Federal Reserve, the Central Bank of the United States, has committed to keeping interest rates low for a long period of time. The stock market is supposed to be the discounted value of the future stream of profits. And if you predict a V-shaped recovery so that America goes back to its norms very quickly, and you think that the central bank is going to keep discount rates very low for a long period of time, you're optimistic about the stock market. So that's the long answer. But here's the short answer, which is what I really believe. I don't know. I think they're crazy. I think the stock market in the United States is grossly overvalued. But I should also say, I've thought that for 25 years and I've been consistently wrong, and I always ignore my own advice.
You have your 401k in the market.
I always have. I've always predicted that it would fall. I've always ignored my own advice. So I urge you to ignore my advice too, but I think it's grossly overvalued.
All right. Next question, Claire.
Okay, thank you for the honesty, Dean Andy. We've got a question on how a government decides which industry to support and which to allow to die. Is there actually a science to this?
There is a science, or at least there's a technique called cost-benefit analysis, where in principle you can hire a bunch of statisticians and economists to think about the benefits of supporting a particular sector, such as the airline sector, which is one of the ones that's most dramatically hit, and you figure out the costs, and if something has a good benefit-cost ratio, you support it, otherwise you don't. In practice, we never see that, because what we see is support typically for large sectors that employ large numbers of people because they can lobby very well. So what should we do in terms of supporting individual sectors? Typically, governments have said, unless there's some very clear present argument that a sector is very important and provides externalities above and beyond its own benefit, government doesn't support it. So you don't see a lot of government support in Singapore historically for many sectors other than providing infrastructure whether it's physical, like roads and water systems, or it can be human capital. So we care about healthcare systems and education. But ordinarily, there's a pretty strong consensus amongst economists that governments shouldn't pick sectors because that just leads to corruption and bad allocations and low output growth. If you have any doubt about that, think about the countries that do choose their sectors, the shining successes of the Soviet Union or Cuba or North Korea.
What about...
That was a joke. You're allowed to laugh.
Ha! What about the airline industry in Singapore, since we're so dependent on international trade and business?
Well, the argument for airline industry is that the standard economist's rationale would be, if you think that the airline is going to come back and only needs temporary liquidity support, then they should be able to issue debt on the basis of expected future profits. Okay, if we think that they won't be able to come back and make a profit, for instance, Singapore Airlines, then the question is, why does Singapore Airlines play such an important role that it needs support when other sectors inside the economy don't? My personal view is Singapore Airlines is going to be very profitable in the future. They can borrow. They probably don't need government support. In any case, many countries have given up on nationalized airlines, such as the United States or Canada or the UK or Germany and so forth. Airlines are just a sinkhole of money, typically. So I love Singapore Airlines. I fly them all the time. I think that they're going to be just fine without government support.
So on this note, we've got some questions asking which business sectors will cease to exist and which would benefit from a pandemic. I think people are hoping to strategize and find out where to place their money next.
Okay. I don't know, but I will say small firms that produce a lot of things in the hospitality industry. So, for instance, people who run stalls in hawker centers, okay, where they're very small operations and they rely to a large extent on face-to-face operations or small hotels, they're going to be crushed so long as there's little tourism, there's little international travel. Those are the ones who are probably going to be doing worse. They don't have lots of reserves to draw on. What's going to be doing well, I don't know. But I would guess that lots of tech that connects people remotely is probably going to do pretty well for a while.
Shall we move to the health sector? There's one on what would be the impact of this pandemic on the health insurance sector?
Well, if the insurance sector has done its reinsurance well, it should be, the entire sector is going to take a hit, but that's what reinsurance is for. So insurance companies don't take all of the liability themselves. They write some of it off by buying reinsurance contracts. I don't know anything in particular in Singapore, but so far as I can see, the health demands have not been particularly high in Singapore because there's been a diminution of the use of services for non-COVID related stuff, which is probably not good for our health over long periods of time. I don't expect anything really big in Singapore. In the European countries, that's all public sector, and most of it is public insurance, not private.
I think we're on to our last few questions now. It's gone on to international institutions. So the question is whether international institutions like the World Bank play a role in this pandemic. Should they limit the number of countries that evolve into economic collapse? And can they stimulate economic rebound?
So the international organizations like the IMF, the World Bank, the Asian Development Bank are simply too small to have a very dramatic impact in and of themselves. When they operate, they typically operate as a catalyst. So when the IMF or the World Bank makes a loan to a country, it's like the seal of good housekeeping, and it tells private sector investors it's a good time to invest. Can they help? Sure, they can help, and nobody wants countries to collapse. If your neighbor implodes, that affects you. Countries that are close to Syria now have been dramatically affected by the Syrian civil war. If you have any doubt about that, think about what it's like to live in Turkey now, or Jordan, or someplace like that. But do the international organizations play an important role? Probably not so much. That's got to be done by the private sector.
So let me just interject then. Granted that an international, the World Bank may not play a big role, but what about having a specific monetary fund for Asia to stabilize the region financially that way? Is there a reason for that?
Well, there isn't such an institution right now, and that's because the Americans don't want it. They only want one monetary fund, which they control, the International Monetary Fund. And that's gone back for dozens and dozens of years. There's sort of an informal Asian monetary fund in the sense of lots of swap arrangements that have typically never been activated, that are very small. But the reason why you need an international organization is you need some independent agency that all the countries trust, which allows them, like Singapore. Is Singapore going to be willing to lend to Thailand or Myanmar or Indonesia, only with the understanding that you have some independent agency like the Asian Monetary Fund, if it were to exist, to assure Singapore it's going to get its money back? That doesn't exist. It's probably not going to exist. But the IMF is just too small to have a big effect on something like this.
Great. Claire, I'll let you have the last question.
Right. I think this one is a popular one. It's about universal basic income, and is COVID-19 the case for it, especially since so many jobs have been disrupted by automation and AI?
No, absolutely not. Universal basic income is just a terrible idea because lots of people don't need it. I, for instance, am one of them. Okay, I earn enough money, I have enough savings. If the government were to give me money, it would be wasted. There are lots of people who are middle class or richer who simply don't need a universal basic income. What we should do, and what governments historically have done, is focus their support on those who need it, who tend to be relatively poor. So I think universal basic income is just a ridiculous idea. There's lots of scientific study on it, and it hasn't worked out very well. If it were to be imposed, it would raise taxes tremendously, which is also not a good idea. But fundamentally, it's just a very regressive idea. Rich people don't need it. Why give it to them?
All right, Dean Andy, thank you so much for your time. This has been great. Your honesty and insight has really been helpful to all of us. Thank you. Now it's over to Dale for current events and what keeps him up at night. Over to you, Dale.
Thanks, David, and thanks, Andy. That was great. This week, I thought we'd talk about some things that are happening. I wanted to talk about contact tracing, Resolve, and what's happening at NUS behind the scenes. So this 3 days, in fact, as soon as I hang up here, I'm running off to this, lucky me, is a global online consultation for contact tracing for COVID-19. This has been a major initiative. It's been driven mostly by Goan in collaboration with WHO, and it's based on the growing acknowledgement. I'm sure you've heard lots about all the apps and how we're going to use contact tracing coming out of lockdown. Of course, many Asian countries had this in good shape already, which is why we did well. But it's going to be really crucial as countries come out of their lockdowns of various sorts. There's also concern that we could get over-reliant on all the apps and think that they're the answer, and how to work with communities in this. There's 350 participants in 63 countries, so it's not small. The opening address was given by Tom Frieden, who's the ex-director of CDC, and now is the CEO of an organisation called Resolve. And I've just got some of his slides with his kind permission, and this is all about what it needs, is that you have to test widely, you isolate all the infected people, and then you find everyone who's been in contact with the infected patients, and then you quarantine and monitor all those people for 14 days. So as I said earlier, this is really how you try and break transmission chains. So how does contact tracing actually work? Well, you first get the team, the contact tracing team will get the initial notification. Then they'll go and spend maybe 15 or 20 minutes with that patient, maybe by phone or telemedicine or however, or face-to-face, depending on what's available. You interview that person, you do an activity map, what's everything that he's been doing for the duration of his symptoms, plus 2 days, because we know that you can be transmitting in those 2 days before your symptoms. So you might have 6 days to go back, and then you've got to go and... So firstly, this interview is really sensitive, because you're asking someone who's sick to tell you what he's been doing for the last week. Now, this could maybe he's been somewhere where he shouldn't have been, or maybe he's sort of raising the names of his friends that are going to be put into quarantine as a result. So even this initial interview is tricky and takes training and skill. Then you've got to locate and warn those contacts and establish whether they do need to be in quarantine. And of course, these poor contact tracers can be hung up on. They can have doors slammed in their faces. Leave me alone, I feel fine. So, and then once they're in quarantine, and you've got to monitor them for disease, but also monitor them to make sure that everything's okay. Are they getting food? Are they getting entertainment? All these types of things. So actually, contact tracing is more complicated than you think. But then actually to do it in a COVID setting, where you've got to build this army of people, and I can tell you when we were in Wuhan, we learned that there were 1,800 teams of 5, so like 9,000 contact tracers. So I know Germany has suggested that every region should have 5 contact tracers for every 20,000 population. So we know in Singapore, after the Ministry of Health people were exhausted very quickly early on, the police force became involved, and then SAF were recruited to join these hundreds or even thousands of people that could do the job. In other countries, as well as Singapore, there's concerns over privacy and freedom. You know, you're telling me to, just because I had lunch with that guy last week, you're telling me I have to lock myself at home for 14 days. So these have got concerns. And how you isolate, can you, what if you live in a dormitory, you know? So there are a lot of countries that actually don't have the isolation and the quarantining facilities. Where do you accommodate the contact tracers? Do they work from home, or do they go in? Do you have to get a new room for them? Because these are not facilities that existed or that were needed before COVID. How do you train them for that empathy, or how to be thorough, how to be fast, but still to be sympathetic to the people that you're dealing with? How do you manage the data? Is it paper? Is there a centralized electronic system? How about the resources to do all this? And I'll come back to that on the next slide. But you know, is there telemedicine? Are there phones? How do you go about the contact tracing? And again, as I mentioned, is isolation and quarantine, is it something that for the cultural context, is it appropriate and acceptable? So just to have a quick look at, you know, what a care package looks like. I recall when in West Africa, they decided to close a hospital because one of the final cases with Ebola was there. This is in 2015. And then they suddenly realized that while all the workers were still in this small hospital, there was no food, there was no entertainment. So all these types of things had to be dealt with very quickly. And the financial support is obviously critical, because to tell someone they have to quarantined for say 14 days, it's most desirable to get compliance to actually continue their wage. And then there's this whole side of this, the electronic apps, which have really never been a feature of Outbreaks before. And there is some criticism that it's unproven technology, feasibility. Will it undermine that traditional face-to-face contact tracing that is needed? And but overall, it's felt that it has a role and will contribute. So as I say, we're two out of the 3 sessions have been done. We've had good examples with presentations from Philippines, South Korea, Vietnam, India, Egypt. You can see all the countries. These have all given presentations on what they do. The first lot were day 1, the second lot day 2, and the day 3 ones are happening now. The technology can assist, but it can't replace traditional contact tracing. And communication and adaptation to the cultures of the communities is very important. Language, how you approach someone, that's all part of the training, and that translates to the success of the operation. Another point being raised is that the well-being of the contact tracers, these are people too, and they're under incredible stress to deliver success, deliver it quickly, often talking to people that don't want to talk to them. So it's all a very sort of worthwhile thing. And as I say, it's been presented by Tim Frieden, this particular one, and he's from Resolve. So I thought I'd give them a little plug. They do develop tracking systems and train contact tracers, develop rapid response teams, lab support. They do a lot of non-infectious disease stuff as well, blood pressure, fats, dietary. And again, I'll skip past that. So what has Resolve been doing during this outbreak? Well, as always, they do a lot. They give a lot of financial support to other people that can operationalize activities, working in dozens of cities. A lot of technical support, working with people to help them create technical guidance and helping countries organise their data management. So lots of webinars, and they're in 62 countries. So it's no small organisation, and my hat's off to them. And if anyone in the audience would like me to talk about any other great efforts during this outbreak, then please send it in. The last one I just wanted to talk about was this is our 10th webinar. Because of the success of having what you can see there is 5,000 registrations per webinar, and a total of 38,000 registrations. It's really quite extraordinary. So we've been extended from the initial package of 12 out to 24, and if you do miss this, or you want to recommend it to your friends, it's there on YouTube as well. Who listens? Remarkably many non-medical people, actually. So I like to think that we find that good balance between technical and what non-medical people can get benefit out of. I think we've got an extremely educated audience, so that makes it easier. But you can see there's 41% doctors, 30% non-clinicians, but there's students, administrators, all sorts of people listen. So that's quite good. And as mentioned, it goes to people in 73 different countries. So you can have a quick look through there. It's extremely pleasing, and that's why it was good to get the extension. These are all the people, the faded ones at the top. Sorry, Andy, you just got faded. But you can see we've really concentrated on having high quality speakers and also a diversity. So whether you've got a clinician or a virologist or a geopolitical expert, immunologist, Alex gave us some great talk on modelling from the Public Health School. Yi Sin, who many people know from NCID, transmission diagnostics and clinical management. Bruce Aylward, who's a household name from WHO, who led our China mission in February. Graham on ICU matters and particularly ECMO, and Audrey last week on leadership. But if you just have a little look down here, I won't spoil the thunder too much, but you've got some great names there. Richard Horton, who's the chief editor of Lancet, David Patterson, who's leading a lot of clinical trials around the world, Peter Piot and Heidi Larson from the London School of Tropical Medicine, Jeremy Farrar, Sir Jeremy Farrar from the Wellcome Trust. There's a lot of great stuff coming up. So bear with us. And I thought while I'm talking about the teams and our reach, I thought I'd just point out for those of you who don't know the COVID Chronicles. We've had about 60 of these now, and these are really about a different form of messaging to the targeting the general public. And again, we've had about 3 million uptakes of these, and they've already been translated into 3 or 4 languages, other languages. And both the webinars and the COVID Chronicles are partnered with GoOn, and that obviously also helps our reach. And you're probably wondering how all this happens. Well, here they are. Here's the people you won't see, but here's Joe's our technical genius. Darius is one of our trainees, and he's behind the scenes gathering all the questions and trying to compile them into things that will cover as much. Nigel leads that group, and Michael leads this group, the NUS Corp team, and this is the MEDEX team. So hats off to all of you for a good success. We're nearly halfway through the, I don't even know if we're halfway through. We'll probably get extended again. But anyway, it's going well, and thanks to you all. Back to you, David.
Dale, are there any T-shirts or tea cozies available?
We're working on it, David. We're going to add a tea cozy person to the team.
It wouldn't be the same without it. All right. Well, it leaves me to thank Dean Andy and Dale for a frank and lively discussion this evening, and to discuss next week's speaker, who's Marie Paul Kenny. She's Director of Priority Research Program of Antimicrobial Resistance at the French National Institute of Medical Research, Chair of the Board, Drugs for Neglected Diseases Initiative, Chair of the Governance Board, Medicines Patent Pool Foundation, and Vice Chair of the Board, Global Antibiotics Research and Development Partnership. The title of the session will be Development of SARS-CoV-2 Vaccines During the COVID-19 Pandemic. What can we expect? There's a chat box at the bottom of your screen. We'd appreciate your feedback. The chat box will be open for another 10 minutes or so. We encourage your comments. Until next week, stay safe and wash your hands. And just to reassure you, the Austin Lounge Lizards have helped us put COVID-19 into perspective by reminding us via their 2011 classic song, We've been through some crappy times before. Good night.